We've heard it a lot recently with the coronavirus pandemic. If you aren't sick enough to be hospitalized, stay away. But what about the many patients, transplant, sickle cell, cancer, immunocompromised, who still need medical care and can't stay away? How are they protected?
I am a breast cancer survivor. Issues as a result of my last chemo as a side effect. I had something they call respiratory spasms. That were just random breathing issues brought on by the chemo. After that, they did some CT scans that showed that lung damage and that I have also an existing lung nodule right now. So that puts me at a very high risk.
Kelly Malott told Newsy much of her cancer recovery treatment, like surgery and follow-ups, has been postponed or moved online, and her oncologist moved up an appointment for a necessary shot.
When I got to the cancer center and walked up, they had nurses stationed at all the doors, sort of like bouncers, asking testing questions about the different symptoms and stuff.
Hospitals across the country have canceled elective surgeries and stepped up restrictions to prevent the spread of the coronavirus. Take Texas, for example. The State Health and Human Services Department there has temporarily suspended visitation at state hospitals and state-supported living centers.
Just a couple questions for you before you head upstairs. Any fever, cough, sore throat, shortness of breath?
HCA, a hospital system with more than 108 facilities across more than a dozen states, has stationed masked healthcare workers at all doors to screen anyone coming through, patient, visitor, even staff. Bottom line, efforts to prevent the spread of coronavirus affect all patients.
Just to mitigate more risk and not take any chances by having large amounts of people inside the walls of our hospital. And then the other thing that we are doing to protect our patients is something called cohorting.
Erica Rosito, the chief nursing executive at HCA Healthcare, says that in addition to an emergency operations center where hospital leadership monitors any patient surges, HCA has limited things like seating to help with social distancing.
We have been very deliberate in segregating those patient populations so that the patients who need to come to us for just their normal everyday life events are still able to do that.
This week, the Trump administration relaxed some telehealth restrictions, including regulations that previously required doctors to be licensed in every state they practice telehealth in. Now, a doctor at a hospital in a state with fewer coronavirus patients could provide telemedicine care in a hospital in a different state, seeing a patient surge. It's also allowed for use of video apps like FaceTime and Skype for telehealth use. Dr. Nicholas Sipsis shows us how doctors are using Zoom, a HIPAA-secure teleconference app, to lessen the amount of times healthcare workers are going in and seeing a patient.
Are there any challenges that telehealth brings that, that seeing a patient face-to-face might provide better assessments for?
There is always a role for what we call the physical exam, being close to the patient and putting your stethoscope on the patient and listening to them. It's the follow-up questions and it's the follow-up information that the patient can provide that can be done via video just as easily as it could be done in person.